Hi, I'm Dr. Bodzioch from Atlanta Chiropractic in Stoneham, Mass. Your Polak posture doc. And we're going to talk about spinal hygiene for your you hockey players today. There is nothing more important you can do to increase your performance level, increase your longevity of you playing the sport, and increase your functional skills, your physical skills on the ice than spinal hygiene. And the reason I say that is the nemesis and the destroyer of most careers is soft tissue. Okay? Soft tissue destroys most of your careers out there, regardless of what you might know about it or not know about it. Specifically, hockey. Hockey is such a physical sport, and it's played on ice, so a lot of times players lose their balance going into those boards, and they're not even aware of the actual impact and traumas they receive. So there's two things that happen with soft tissue, right? So soft tissue can go into these lines where it's squigglies, okay, versus these lines, nice linear lines. This is a healthy soft tissue. This is not a healthy soft tissue, right? Squiggles. So what happens when that soft tissue is compromised? Okay. So you go into the boards, and instead of your head being up, it's down. Okay? And you collide into that board. Helmet first, head down. There's a lot of things happening, but if we look at the soft tissue, okay, soft tissue is going to get laid down because there's subluxation and postural irritation in here, mechanical distortions going on in here, because these joints, this neck area has been traumatized, and because it's been traumatized, the body's trying to what? Support it and help it. So what does it do? Lay down scar tissue into that neck. And scar tissue is like glue. When that scar tissue gets in there, it what? It decreases the motion and mobility in this neck. When it decreases the motion and mobility in the neck, what's it gonna do to that? The mechanics in the neck, it surely isn't going to create more mechanics. It's going to create what? Less mechanics. And because of the less mechanics, there's going to be more distortion in that neck and more irritation. And that mechanical distortion and irritation's going to be related directly to neurology. I've said it before, I'm going to say it again. Concussions are just merely mechanical dysfunctions in this structure. Because of the mechanical displacements in this structure, the actual neurology is compromised. And the neurology is compromised whether it's through neuropathy or radiculitis going down into the arm, inflammation in the neurology and the nerve roots, arthritic spurring in these joints because it's been traumatized so many times, or literally just degenerative joint disease. The disc spaces are decreasing, the actual degenerative changes, osseous changes in this neck is starting to build up. So the best thing you can do as an athlete is to keep the motion and mobility and the movement mechanics in this structure. Because when these joints are all moving, they can what? Accept that blow. If these joints are fused and there's actual scar tissue in here and there's glue, and so half of this neck is jammed up, right? It's not moving. Half of it is moving. Now you take another hit going in the boards. What do you think your chances are of becoming injured when you don't have half the motion in your neck versus having 80% of the motion in your neck or 90% of the motion in your neck? And you're not going to probably get this from most of your medical. I'll take that back. A lot of the medical teams and specialists are starting to realize this. There's still a good portion that don't. So this is something you as an individual, you as a player, have to realize and make a distinction and seek it out on your own. It's just common sense. Neurology, mechanics of the joints that protect and support that neurology. Somebody thought it important enough, right, to encase this power cord or spinal cord in 24 movable joints. Also, they thought this cerebral tissue, your brain tissue, was important enough to put it in a skull capsule. So they knew that this neurology was super important and wanted to protect it from accidents, injuries, or traumas by putting an osseous structure around it. Well, that osseous structure, which is your spine, can make compromises or compensations when it's traumatized. And when it's traumatized, if it's not followed up, those complications and mechanical distortions and mechanical compensations are going to cause further injury. Right? So let's just take it real basic, right? You're skating down the actual ice and somebody slams your shoulder and rotates your upper torso. You get off the ice and you start moving around. You got low back irritation. You're getting spasms in your low back. The game continues. The game's over with. You come off the ice. You take your shower. Your trainer checks you out and he says, how's your shoulder? Oh, it's moving fine. How's your low back? Oh, it's a little stiff, but I'm fine. But you know what? You still display this rotated thoracic cage. And most of the rotation occurring right between your scapular blades and in your mid-back. You go to practice, you're fine. You know what? Then somebody hits you here in that shoulder or in that mid-thoracic area in your thoracic cage, and it rotates again. And you feel a little twinge and irritation in the low back, but you skate, you ice it down, no big deal. And those little traumas, those micro traumas keep happening day after day, or let's just say game after game, and practice after practice. A year goes by down the road, you got this rotation, right? Even when you sleep, you don't sleep into the shoulder, you sleep away. So you're sleeping on your back, okay? So you don't push that shoulder or that thoracic cage forward because there's irritation. Next thing you know, you're starting to get nauseated. And after the nauseation, or you're getting nauseated over a period of time, okay, 2 months, 3 months, 6 months, then you start getting dry heaves. You go to all your specialists, they can't find out what's going on or why it's happening. They do your CT scans. You go to your gastrointestinal physician, nothing's wrong, okay? But you still display this rotated thoracic cage, and it starts in the mid-back, right between the shoulder blades, which happens to be pinpoint of T4, 5, 6, and 7, which is your stomach, small intestine, and large intestine. So the whole reason why you're getting the results that you're getting with the stomach, the nausea, throwing up, dry heaves, is because that mid-thoracic is rotated right in the area of the nerves, the peripheral nerves that go out to the stomach, small intestine, large intestine. And there's enough distortion and mechanical irritation on those nerves that cause that response. And you spend a year and a half going to all your specialists, okay, that come up with nothing. And then finally, somebody refers you to a chiropractor. He starts working you, takes out that rotation, so now those shoulders come square, rotation comes off the mid-thoracic area, the pressure comes off the nerves that communicate to the stomach, small intestine, large intestine. Guess what happens? By some miraculous way, you stop feeling the nausea in your stomach, you stop getting the dry heaves, and you stop throwing up. Amazing. Actually, it's quite simple, right? Because it's the truth of how this machine runs. We are a spark. The better the spark expresses itself, the better the hardware responds. The spark is the software. The hardware is the organs, muscles, tissues, and glands. That spark has to move through those 24 movable bones. Those 24 movable bones become more decayed, more degenerative, more deconditioned, results in a more irritated message, instruction, or direction, which results in a more irritated response. And what's the benefit, right? The benefits of you getting adjusted consistently, even when you're not in pain, is the mechanics and motion that you've established in that spine. So now you are skating, somebody does check you, and instead of this thoracic cage rotating and going back and locking out or subluxating in that actual rotation, now there's enough mechanics and motion in these joints that they can absorb that hit and return with a normal range of motion mechanics. Because there's enough joints in that spine that are pliable and have the mechanics that they can absorb that shock. So what's the old saying about basketballs? It's not the bounce of the basketball, it's the rebound of the basketball. It's not the music note, it's the space between each musical note that produces the music. It's the same premise in our structures. It's the mechanics and motion that provides us the availability to rebound after a trauma, an accident, an irritation, an injury. And these athletes are starting to realize that. Right? That's why you're starting to see athletes starting to play into their 40s and late 40s like Brady. Because they're starting to take care of their bodies and they're providing it the environment for it to flourish. And for it to rebound even when it is irritated, injured, or aggravated. If you want to be a star player and you want to be a superstar, not just a star, not just a player, but a superstar, you got to go the extra distance. And you know what? Being a superstar isn't about the big things. It's about all the little things that make the big things. And health is the number one pillar you need to pay attention to. Because from what I gather and what I see and what I read, most careers are ended because of some injury, some health issue. So that's the number one place you want to start, is with your health. And making sure you do the fundamentals to stay healthy, whether you're playing or not playing. Again, it's Atlanta Chiropractic in Stoneham, Mass. 781-GET-WELL, 781-438-9355. I love to start these kids early, right? Before they start getting irritations, before they start getting mechanical distortions, postural distortions in there. That's when you start them young. Your parents you're investing a whole lot of time and energy into these kids, right? Not only just energy getting them to the events, but their equipment, their flight to get there, their time. So my premise is this is the very best thing you can do as far as the amount of time, the amount of energy, and the response and the benefits you're going to get. So again, love to see you in. Give us a chance to check out your child, your hockey player, the hockey player, any hockey players. Let us look at their structure, check it, see what we got for mechanical dysfunctions, for curves, so they can play the game, play it healthy, and play it at a peak performance state. Appreciate it. Have a mighty Monday. Look forward to seeing you. Have a great night. Bye-bye.